Hello and welcome to our broadcast. I'm your host today, Matt Colmia. I'm Executive Director of Digital Strategy at Providence. As a quick reminder, the information provided during this event is for informational purposes only. For any medical questions, please reach out to your primary care or healthcare professional. Now let's go ahead and get started. Joining me today for this event, very excited, is Doug Grabsky. He's our Senior Digital Strategy Manager with the Providence Digital Innovation Group. How are you doing today, Doug?
Doing well, Matt. Excited to be here.
Yeah. So let's go ahead and get started. To kind of set context, tell us a little bit about what you do in your role with Providence and how you're related to this space.
Yeah, absolutely. So I'm currently a senior manager on our digital strategy team as part of the Digital Innovation Group. So the Digital Innovation Group is a unique enterprise support team that Providence has and consists of a strategy team, a product team, and some really talented engineers as well. And our role on the strategy team is to work closely with our caregivers, work closely with the Providence leadership teams, understand their problems, really figure out what they're working through, what's keeping them up at night, kind of digging into those issues, and then going out to the market and actually seeing, are there any companies, are there any vendors that are already offering that solution? Do they have a pre-built solution that we could bring in and pilot? If yes, we like to figure out who's best of breed, run head-to-head pilots, and be really, really intentional about who our partners are. But if there's no one that's kind of solving that need, our role is actually to kind of think about it as a potential business opportunity, a new product that our product team could run with and build a solution ultimately that could work in our health system. We could build it, scale it there. And then the big picture goal is to take those products and opportunities to other health systems and help them out as well if it's a unique opportunity.
Great. Super helpful context. We'll dive into questions about digital services bundles and fixing the surgical experience in a sec. But first, I want to say for all the folks out there, if you have questions at any point, just drop them in the chat. We love some engagement. We love this to be pretty conversational. I've got my questions here, but let's make this a sort of a group thing. But so to get us started on the topic for today, Doug, how would you describe a digital services bundle, and then how does it apply to healthcare? What is that? What are we talking about?
Yeah, absolutely. So I'll start by just kind of thinking about what is a digital services bundle, right? So I think of it as a set of elements, capabilities or even features that you could piece together, combine them together, and use those separate but powerful elements and actually use that to drive an overall experience, whether it be a care journey or whether it's something, some other transaction that you as a consumer out there are looking to complete or looking to create. So I think a great example that I like to give is looking at how real estate has evolved over the past decade or so. So previously, I think when you were shopping for a house and looking for a new home, you work closely with the realtor. They had all the listings available to them kind of behind the scenes through the MLS database. And then you kind of compare that to what Zillow and Redfin have done over the past decade or so, and actually taking that that offline MLS database, put it online, put it in the hands of people. You could see kind of democratize. I think of it as really democratizing all that information, giving it to consumers, giving it to people that are looking for homes and shopping. And then the unique parts that Redfin has done is actually add all those other service elements back in. So they've added in those real estate brokers, so they do have brokerages associated with them now. They're connected and they'll link you to mortgage companies to help you figure out how you apply for a mortgage. And then they even have started to move into the actual home purchasing and ultimately reselling space as well. So they started with that kind of core thing that engaged people, brought them in, and then started wrapping around all these other elements or features into that bundle. And so it's really become this kind of unique digital bundle that you can ultimately make transactions on and kind of complete a set of tasks. And home buying is not easy, but they've kind of put a lot of it online and made it way simpler for patient or for consumers.
As somebody who went through that process a couple of years ago, I really like that analogy of the Redfin Zillow. Right, I can't imagine trying to do that process without it.
Yeah, it's a little shocking.
And so can you talk a little bit about that word bundle though? So bundles around surgeries from an actuarial and payment reimbursement standpoint means something. But also if we're not talking about that, we're just talking about the products, like why a bundle? Why aren't we just talking about single digital product here?
Yeah, no, great point. Yeah, so yeah, their CMS does have the bundled payments program where it kind of encompasses a complete surgical journey all the way from the preoperative visits through the procedure, the hospital stay if there's associated stay with it, and then a lot of those bundles include kind of a warranty, a 90-day warranty or a 30-day warranty on any kind of readmissions or adverse events that might come. When we're talking about the digital bundle about surgeries, we're really thinking about what are the elements that you need to engage with a patient, a consumer throughout their whole care journey. It's a confusing experience if you're going through a complex procedure. You're talking to a lot of different care team members, whether it's a surgeon, a nurse. You might have even started that whole journey with your primary care physician. But thinking about how you got through all those steps and how you engage with that care team throughout it's really tricky, and it's hard for patients. It's hard to understand. And so we're really trying to take those communication elements, those access elements, those navigation elements of that whole journey and kind of piece them together to create kind of one unique product that guides them, a patient through their journey. So if it's a referral feature that we need to get patients in and get them an appointment, that's a starting point, and then you kind of can follow the care journey down the line from a consultation and potentially a procedure, or potentially a referral to another an alternative therapy, whatever's best for the patient at the end of the day.
Okay, so we're talking about disparate parts of the experience that need to come together, as well as disparate tools that could go for each part of the experience, all being brought together. So it's just simplified.
Exactly. Yeah, and just trying to make it so if you think you could complete that whole home buying transaction on your phone or on your iPad, whatever it may be, why can't you engage with your whole care team that same way? It's kind of taking what's been a messy, complicated experience and just making those connections a little more seamless, kind of keeping it all in one place that you know where to look, you know where to start, where that information is going to come in next, and it's easy to understand it and really just take that confusion and that frustration that we often see in healthcare out of the journey.
That's great. So let's get a little bit of background on Providence. We know that no one in Providence certainly hasn't totally solved for this. There's no magic bullet, obviously, but this is work that's been ongoing for some time. I know you've been leading it. Could you give us some sense of when Providence Digital Innovation Group sort of started to ramp up on this project? How did we get here?
Yeah, absolutely. So I'd say, this project predates my time even at Providence, but it started with a care journey or a domain. We typically work in domains called Simplifying Care, and the goal is just to figure out a better digital tool to engage with patients throughout their care journey. And so I know several members of our team were involved in that whole project, and I'm sure I know you were as well, Matt. But the goal really there was to bring in a vendor to help communicate with patients throughout their care journey. Flash forward probably 2-ish years or so, and we've all been living in the COVID pandemic since March of 2020, and as part of that, part of the pandemic, we as Providence had to made the decision and opted to actually shut down a lot of our elective procedures, put them on hold, delay them, whatever was best for kind of that region, that individual ministry at that point in time. Knowing that patients that absolutely still needed care at that time could come in, but otherwise we wanted to keep things on hold. And so what we did is, and this is kind of when this project was reignited, is the way I like to think of it, and it came back together. But we said, what tools do we have in-house today that we can make it easier for our providers to still see patients throughout the pandemic? Consumers were afraid to come in for services. There was kind of a fear, and it was that big period of unknown where no one was super certain they wanted to go into a hospital. You weren't sure what you might or might not be exposed to, and so we said, let's take that care pathway tool that we brought in several years ago, and let's actually combine that with some other elements that we already have in house. So that's where we said, our telehealth team did a great job standing up all of our providers on Zoom and telehealth platforms that was really rapidly adopted and utilized throughout the pandemic. So we said, what if we take that care pathway tool, combine that really with virtual visits, and just say, hey, this is a good starting point of how we engage with patients through digital channels, digital components of that care journey. We combined those two initiatives, those two projects together, and then took it one step further and said, how do we make sure patients know that we're offering this, that it's available to them? It's a new concept. It's a kind of a unique experience for patients. So another part of the Digital Innovation Group does a lot of our website builds and a lot of our marketing materials as well. So I worked closely with those two teams to create some new websites, some new ways for patients to actually request appointments as well. So if you're looking for a service on an individual service line, whether it be a spine procedure or an orthopedic procedure, you could actually click in and see, oh, Providence has this new digital surgical experience that they're offering. You can kind of follow the site there, identify surgeons who are actually offering that and practicing that way. And then on their profile is actually a button that lets you fill out a simple form that collects your essentially your demographic information of who you are as a patient, some of your insurance information, what are your chief complaints, a lot of those kind of basic questions that you start with for any office, but you can fill it out online, quick and easy. And then what happens is our patient engagement center will then call that patient back within certain timelines and actually work with them, communicate with them and say, hey, really, what is the issue you need? Let's work to get you scheduled for an appointment and make it just so much simpler for patients to come in. Whether it's an in-person visit or a virtual visit, we just wanted to ease that process and that experience for patients. And so that's really where we kind of going back to your original question, that's where we started. Is we just said, let's use the tools that we have in house. Let's build something quick. Let's piece it together as quickly as we can and help make sure that the patients that need care are still getting that care throughout the pandemic.
Yeah, that's a great example. I know that throughout healthcare, and I'm sure a lot of the folks on the call can relate to this, we all sat down and banded together and said, okay, what can we respond with quickly? And it was a great example of how being a digital leader enabled us and a lot of other health systems and being digitally prepared to then be nimble in that moment. And what we did was take, to your point, a couple of solutions that were already within our ecosystem, maybe not being used exactly for this, and stitching them together into a quick MVP. So that's a great starting point.
Yeah.
As you look, oh, go ahead.
Oh no, I was just gonna quickly add, it's as our new teams that hadn't previously worked together. As part of this, we got to figure out how to work together, how to communicate, and how do we actually track patients throughout this whole experience as well. So there's some great learnings, but also some great kind of team building and partnerships that really went into this whole project. Of course, it wasn't just me. I can't possibly do all those things. Don't know how to build websites or anything, but it was a great opportunity to take all the elements and teams within DIG and actually piece them together as well. Absolutely.
So now with that MVP sort of like set up in some clinics, like as you look forward, how does, and I know there's just a billion like ways of this, but like how does digital health technology fit into the surgical episode, or where can it fit? Mm-hmm. All the way from like scheduling the first appointment with a specialist, all the way through sort of post-op care. There's a billion steps in between. Where are the opportunities for digital to play a role here?
Yeah. So I like to kind of break that one down to your point. There's a lot of steps and a lot of different places. I think of them as kind of just breaking them down into little pieces, little segments of it. And even upstream of that first appointment or that first kind of referral that a patient might have, I think of this as a demand generation kind of bucket of tools. But it's ultimately, how does a patient pick a provider, right? How do you know if you've got terrible knee pain, you've seen your primary care physician, you've been to physical therapy, you tried a lot of different things. He or she may refer you into a specialty provider, but also you want to go as a consumer, you want to make decisions for yourself sometimes too. You want to go out to, look online, figure out which surgeons are best for you. So that's where I kind of think of it as this demand generation piece and this online presence piece where we're explaining what our surgeons are doing on their profiles. We have really nice, websites that explain the offering to patients and explain why it's easier for them to come in for our services. And I think that helps differentiate, just us as in a competitive market, really.
Yeah, almost nothing we buy where we don't Google it first.
Yeah, it's cost and quality of are for all of our, in all of our markets, we do a great job on both the cost and quality elements. We want to make sure that patients can also, understand we have a better care experience for them. So that's kind of the first element that I think of is that, demand generation and that kind of web presence, if you will. From there, it's all about kind of how do you catch that patient when they reach out to you. I think of that as it's that inbound referral. It's that lead generation form that I kind of talked through a little bit previously, or it's that phone call that goes either to our patient engagement center or even directly to the clinic themselves. But it's really about accommodating that patient, making sure that you're addressing their questions, that you're able to get them in a timely manner, and that they're sending the patient to the right specialist as well. So that's another real critical component of this is the way we've built out some of the navigation with our patient engagement team is want to make sure the right patients are making it to the right surgeon. I don't want to be sending a teenager to an orthopedic surgeon who specializes in hip replacements. It's not a good use for that patient. They're not going to get the help they need. What it may be doing is that surgeon who needed to see someone who does have some significant hip pain, it's kind of taking up a pretty time constrained appointment slot on their end too. So really just wanting to make sure that the right patients are making it to the right provider from there. At that point, it's the patient's kind of in the surgical funnel or that specialty journey, if you will, and they're meeting with their care team. They're having those kind of assessments done, and so that's where the adoption of telehealth has been super powerful, super helpful in this journey. Where as a patient, you could just like we're talking kind of remotely today, you can actually engage with your surgeon through these channels. Have that initial meet and greet rather than having to drive into downtown, whatever city you live in, and sit in traffic and pay to park, et cetera. You can have that first kind of visit virtually, understand what your needs are as a patient. The surgeon can order potentially, whether you potentially need any lab work done, any imaging done, and they can actually order that up and do that without having you drive down there. You could go have those tests. And then actually when that's all complete and the imaging is done, you as the patient could actually go in person with the surgeon. They could review those files together and really work through that case. But it kind of saved you as a patient some time and not getting the answer that you're looking for on that first visit, and knowing that you often have to go through several iterations of visits with the surgeon before you really understand the root of the problem that you're facing. From there, I think the pathway typically will kind of split, whether an operative patient, whether you need surgery, or if there's an alternative therapy that's more appropriate. So, it could be that 17-year-old kid that went to the orthopedic surgeon, but he actually just needs to do some more rehab at home and some physical therapy, some much simpler kind of non-invasive treatments. That's often and the best course of treatment for most patients. It's puts less risk on the patient for, in terms of surgical infections. It's also just less costly, right? It's less disruptive to their life as well. But for those patients that do end up needing some type of procedure, some type of more, bigger intervention, I think the next kind of set of components where digital can really play a big role is understanding the patient's risk factors, kind of collecting a lot of that preoperative assessments that as you're a patient and you get worked up by a nurse team or a case manager on, I have some comorbidities and that needs to be factored into how my procedure is done, where it's done, what type of anesthesia I'm getting, I receive from the anesthesiologist throughout the procedure. Kind of all those health elements that I have, we want to make sure those are captured and informed for the whole care team and that whole surgical team up front, that they can really make the right assessment of where that procedure should happen. Wanting to make sure that's it's happening in the right setting first and foremost, and then secondly that the patient, if they do need any long-term hospital stays, that they're kind of discharged the appropriate care setting. So I'm thinking about whether a patient should be discharged to a med-surg floor, to a critical care floor, whether they may not have the best home environment as well. So there's some instances where it's best for a patient to actually be discharged to a rehab facility or a skilled nursing facility for a set period of time. If we found out up front, hey, this patient doesn't have a good home environment, and they might have a lot of carpets around their house, and they're going to be coming home with a walker, and it's not going to work well for them. Let's send them to the right care discharge facility, and make sure that they're set up and optimized, if you will, to recover safely and as quickly as possible. So that's kind of that navigation piece, both for the site of care and then the post-operatively. And then kind of if you're really thinking all the way through that whole surgical journey, most patients, if you have a knee replacement or if you have any sort of orthopedic procedure or spine procedure, you're probably still going to have a lot of post-operative care as well. So wanting to make sure that the wound is healing appropriately, that the patient is not having any bad effects from the anesthesia. And so this is where the telehealth services, the virtual care can come into play again, and where that care pathway tool that I mentioned at the start of the call too, you as the patient can actually utilize that tool to send pictures in to your surgeon. Oh, the surgical wound looks infected. It's a little red. Why don't I go ahead and send it to my care team, to my nursing team, have them review it. It saves me the trip, an uncomfortable trip, likely back to the hospital, and having to see them. They can make that assessment in near real time and say, hey, that looks rough. Get in here as quickly as you can, or oh, that's just some swelling. It's normal. I recommend some additional icing, and call me in 4 hours if it doesn't go away. So that's just an easier way for that patient to receive that care, to communicate with that care team, and hopefully save some burden on their end as well. So
what I heard there is that while there's a lead gen component, I'm just picking out one section of that. While there's a lead gen component, this isn't simply about surgical market shares or filling ORs. This is about casting a wider net, serving a broader population of patients, some of whom will wind up in surgery potentially, but some of whom may be directed that they actually don't need surgery, and this other care venue is more appropriate for them, finding the right care for them, the low cost, clinically appropriate care venue.
Exactly. Yep. Yeah. And so I think the last piece that I'm not sure if I mentioned entirely, but for patients that don't need a major intervention or a procedure, there's some really neat digital tools, digital offerings that all about
absolutely
post-op, about rehabilitation care, and a lot of the virtual rehab programs that are out there. So really, really neat programs where patients can be prescribed certain types of exercises. I think a lot of them have videos that actually walk you through how to do it. You could really take it a level further, and there's some companies that offer sensors that you can place on your body. They'll actually track your movement in space, right? And know, hey, you're not fully extending your knee. I can see that your knee's only going 60 degrees, and you should be at the full 120 by now. Whatever it may be, there's some cool, really, really neat digital tools that can help address that as well. And again, it's those types of digital offerings, they scale really well, right? So it's really a low cost for the patient. It's much lower cost even than going to an in-person physical therapist and things like that. So it's just a simple way to get patients the help they need, and you can do it in your own home on your own schedule, right? You don't have to shuffle around town, and it's just much more convenient at the end of the day.
This is where I have to mention that Doug's not only a subject matter expert because of his job, but as a recent ankle surgery patient, has seen this space from every which way, and a lot of his insights are formed by that as well. So thanks for taking one for the team on that one, Doug. We really appreciate your commitment to the project.
Yeah, it's I'm waiting for the expense to clear on my insurance deductible.
That's a whole separate problem.
Yeah.
So we've talked a lot about some pieces of this, but if we're just go directly at patients and the consumer experience, how does a digitally enabled, we talked about a bunch of different, this tool is great, that tool is great, but what do patients feel and see with a digitally enabled surgical experience? What's the difference that they feel?
The difference is that it's just I would think of it as it's a simpler experience for them. They can look in one application and just see all of their messages from the care team. They can see the pictures that they've sent to their care team. They're not bouncing around different sheets of paper that you get when you often go and visit your provider. I've lost several of those throughout my own surgical journey that had all the instructions. So just having all that information where it's stored in an electronic format and it's accessible, readily accessible. You can pull up whatever you want. We all keep our phones probably within 6 inches of us 24/7 these days. So just having that availability and that consistent access, I think just really makes it easier for patients, and just puts, frankly, just puts less stress on them throughout the journey. It's complicated. It's it's nerve wracking, right? You don't know what's going to happen.
Surgery, yeah.
It's a spine procedure. It's a whole new body part that's getting put into you. It's just really stressful for patients. So if you can eliminate just some of those elements and make it easier, that's really what we're shooting for.
Yeah. I have a bunch more questions, but really quick, I'm going to do a time check. We have 5 minutes left. If folks want to drop more questions in the chat, I've still got a few here. We can start to close things out, but let's take the flip side and now talk about providers and specialists. So, obviously every new process and process change, every new tool comes with some sort of workflow costs to providers, plus the financial cost of a solution in this space. So what's the benefit to providers and specialists? What do they get out of dedicating their clinic staff and their teams towards a sort of digitally enabled surgical process?
Yeah, no, great question, and it's certainly something we will try to work closely with our care teams. We don't want to be changing processes all the time. We don't want to be adding new tools all the time. That's really not our goal, and that's why we started with just the tools that we had in house today. They were already using them. They already knew how to schedule things in them. They were already had the dashboards enabled and built out, and a lot of that was already done. And so our goal is just to minimize the amount of effects on the care team. But make sure that these tools are actually we're kind of further optimizing these tools and making it that those patients, the providers are getting the right patients coming into them. So that's where the demand generation piece and kind of those routing elements really come into play for those surgeons, that they're not seeing the wrong patient that they didn't train, for several years and through residencies and fellowships to see the wrong patient. They want to get the right patient in. They've trained and they're highly specialized to treat those patients. And frankly, they love doing it. Like if you you spent your whole life and dedicated your whole career to that, you want to be able to help those people. And so getting those right patients to them really makes it easier for them. It lets them provide that value that they've back to the patients that they want to be able to deliver. The other element of this is those additional touch points and those additional kind of communication channels into the care team. It just makes it a little bit again easier on the care team as well. I know we've spent some time even doing actual time studies and working with physicians and watching them as they do a virtual visit and they go see an inpatient visit, and how does the rooming work? How does that impact timing? And what does that look like to their day to day? And so we've been pretty intentional about how those get scheduled, how that works, but really trying to just make it so if the patient can just send in a picture message of their wound, and the care team can quickly message back, it might actually save one of those phone calls that's coming in from the patient who gets put on hold for a little while. They may not immediately find the right care team member who can answer them if you're assigned to different care teams. So really just trying to ease some of those administrative burdens back on the care team as well from some of those more operational types of tasks that they frequently have to deal with as well.
Yeah, it sounds like in part what this does is allow everyone, including the clinic staff, to operate really top of license, which is always an efficiency goal within healthcare.
Yeah, no, absolutely. That's definitely the goal here.
All right, just a couple minutes left. Is there anything else you'd want to add that we didn't cover during today's conversation, Doug?
No, I think the biggest thing, I guess the only other thing I'd like to just touch on is the one thing we're hoping to add into this experience next, or really digging into a lot deeper, is all about that site of care navigation. So figuring out where does this procedure need to occur, and what's ultimately the right price, the right setting for that, knowing that there are different prices, whether procedures done in an inpatient setting, in a hospital outpatient setting, an ambulatory care setting. And there's some regulatory changes that are happening through CMS, and ultimately probably the commercial payers will follow suit where certain procedures are paid in for in certain facilities, we want to make sure that those routing elements are factored in, and that it's ultimately giving patients that lowest cost site of care. That's often one of the biggest drivers of those high bills that come through, is that facility fee, if you will. And so really being able to do that, send patients to the lowest cost option, but also the one that's best suited for them, right? We know that upfront that you have several comorbidities and you need to be operated on in a hospital. We want to do it in a hospital because it's safest for the patient. But otherwise, we want to make sure they're going to the right lowest cost facility for them. So that's just the other big element that we're hoping to add into this next and dig a lot deeper into.
Awesome. Excited for next steps, Doug. Thank you, Doug. I think we're going to wrap. Thanks for joining us today. Until everyone listening, sending in your comments and questions. To learn more about our initiatives, programs, services, or if you're looking for medical care, of course, please visit providence.org. For more information and resources from Providence Dig, including an awesome piece that Doug wrote on this very topic, couldn't recommend it more highly, visit providence-dig.org. So you add the providence-dig.org. Follow us on social media, Providence Health System for LinkedIn, Facebook, Instagram, and under just Providence for Twitter. Not sure why they're different, but they are. Anyway, thanks everybody. Appreciate the conversation today, and have a good one. Bye.